Welcome back to Wisconsin Family, everyone. We're here at Supercharged Foods. We're going to catch up with PT in a little bit. Let's stay with the theme of staying healthy. We have Alex here from Pinpoint Diagnostic, Soundwave's Imaging. His friends call it PDSI. I did. I almost got through it. So, Alex, good to see you again.
Good to see you guys. Yeah, thanks for having me.
So, from where we left off last time, one of the questions I had that I didn't get to ask was a little bit about your title and your experience. So why don't we pick up there?
So yeah, I'm a medical sonographer. So for a lot of people, or layman's term, that means I'm an ultrasound technician.
Okay.
With 7 years of experience, or a little over 7 years experience, doing ultrasounds on newborns to senior citizens and in between there. So that's a little bit of the title and the experience there.
All right.
Great. And what attracted you to the field of doing ultrasounds? Obviously, it sounds like you got into ultrasounds and then decided to start the business, but what brought you into the field of ultrasound?
So yeah, ultimately I wanted to kind of help people, and the healthcare kind of allows you to do that. So it came down to two choices. It was either X-ray or ultrasound. And X-ray uses radiation,
right,
and ultrasound uses sound waves. So I figured it was a lot safer and a better route to go do ultrasound.
Yeah, absolutely. Yeah.
So why would someone need an ultrasound then?
So there's
several reasons, I'm sure.
Several reasons, but there's three big reasons why somebody would want to use ultrasound. The first one is in a preventative or wellness screening. Okay. So this is for individuals who have high risk factors for a certain disease, and so these are kind of diseases like stroke or thyroid cancer, or in aneurysm. When you talk about aneurysm, that means like the main artery in your abdomen. It's just kind of like a balloon. It gets really big and bloated.
Okay.
So if you have these kind of risk factors, ultrasound can be used to kind of screen for this and catch it early, so you can get that early treatment. And then the other way is what we call a diagnostic screening. So this is the typical people that come to the hospital who are having pain and discomfort, and the doctors are wanting to rule out is it your gallbladder, do you have a blood clot? So ultrasound can be helped to kind of diagnose those symptoms and those problems. And the third way you would want to use ultrasound is a point of care. And so anytime you're involved in a trauma where whether you get involved with a car accident or you fell down and hurt your abdomen, ultrasound can be used to look inside the abdomen and to kind of see if there's any fluid or if there's any bleeding, some signs of trauma that you wouldn't expect. So there's lots of ways, and those are the three key ways to do ultrasound.
Oh, great.
Okay, so you were talking some about preventative medicine, which people want to do this ongoing. I don't know if it ties in, but I know that you'd also said that there's some free services that you offer. What are some of those services, and is there any tie-in there?
So those free services that we provide, they're listed on the website there, and it's to educate and promote the different types of services that ultrasound can be used for. We always say, pregnancy ultrasound is what ultrasound is primarily known for.
Sure.
Mm-hmm.
But with these, with the free demonstration ultrasound that I provide, if you're having discomfort, or if you're having pain, and you just want to see what that looks like on an ultrasound, stop by, call us, give us a call. We'll set something up. You come in, get that checked. Like I said, our guidelines do say that when we're doing this, if something doesn't look right, we'll make the recommendations to follow with the provider. And if you need to have the diagnostic service, that's what we provide, the affordable service, right?
Sure.
Yeah.
And one of the advantages of going to a place like PDSI is that you don't have to. You probably can get in a lot quicker. Most people can probably get in a lot more quickly to see you than maybe to see their primary care or going through their primary care physician. Mm-hmm. I know that your service is self-pay, which means you don't take health insurance. So do you have options for people as far as getting their bills taken care of and things like that?
Yeah, so what I found out was that insurance companies will regulate the prices for these services.
Okay.
And so that's why it was very expensive.
Right.
So we wanted to be advocates for individuals and say, well, let's set one price.
Yeah.
And so it is a self-pay, but it's a lower alternative.
Okay.
And so we do have payment plans options that we can set up. People that have a health savings account or a flex spending account, this is a medical service, so you can kind of use that
Sure, yeah.
for these kind of services. And you talk about getting in for these services without having to go to a primary, and it's so true. I've dealt with a lot of patients or individuals that say the provider, sometimes their doctors don't listen to what they're saying, and they wish they could take their health in their own hand. Well, this does allow for that, because then you can come in and get an ultrasound done, and who knows, if you find something, you can we do give you a copy of the images and the report. And that's all included with our price. So you should, if there's something seen, you can take it back to your provider and say, hey, I wasn't, losing my head. Look, there is something.
There it is. Yeah.
There it is.
Yeah, it's a way. In a way, it's a way to be proactive and even just having someone that's looking out for you, which is a good thing. That's great. So, and like you said, there's a lot of information on your website. I suggest everybody go and check out more of how Alex can be a resource to you. And we'll be right back with more Wisconsin Family after this.